Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Alimullah Zuhaib, Abu Dhabi licensed pharmacist. Today is our first free session for GCC countries. A little bit introduction about how to become a registered pharmacist in GCC countries. GCC countries is the union of 6 countries named United Arab Emirates, Qatar, Oman, Saudi Arabia, Bahrain, Kuwait. There are common things to register. Every country has their own set of process to register, but the common things are the primary source verification by data flow group, and then you need to write a computer based exam, and after the exam you get the job and activate the license. The every country have different exam. Like in United Arab Emirates has 3 different exams: DHA for Dubai, MOH for Sharjah, DOH Had for Abu Dhabi, Qatar QCHP, Oman OMSB, Saudi Arabia SPLE, Bahrain BPLE. For Kuwait, the process is different. They are not taking exam. They are you need to get job first there and activate license by the employer. The same process, the common process, like primary source verification by data flow group, eligibility, and a computer based exam. After the exam, you get the job and activate license. Do every country, every health authority have different process, but the common things are the primary source verification and exam. Today is the first session, and we have choose the topic sulfonylureas. Sulfonylurea is a class of medication used to treat type 2 diabetes by increasing the insulin secretion. It is mainly used for type 2, not type 1, because type 1 don't have the beta cells on which the sulfonylurea act. It was introduced in 1950s for the first time and still are used due to its efficacy and cost effectiveness. Efficacy means if we compare the drugs and the drug which have more therapeutic effect is considered more efficacy. Which drug has a more therapeutic effect has the drug has more efficacy. Classification: the first generation tolbutamide, chlorpropamide, acetohexamide, tolazomide. These are less potent and shorter duration of action. Now, the less potent mean more dose is required to achieve the therapeutic effect. The second generation glyburide, glibenclamide, glipizide, glyclazide, glimepiride. These are more potent, longer duration action, fewer side effects. Now see the potency. Less potent, more potent. The two drugs for first generation and second generation are used to achieve the same therapeutic effect. For the first generation, we use more dose, and for second generation, we use less dose to achieve the same therapeutic effect. Like this is therapeutic effect. This is effect something. These are the dose. The first drug that is less potent has more dose. The more potent the doses require less for that. Mechanism of action. It acts on the beta cells of the pancreas, binds to the sulfonylurea receptor, one of the ATP sensitive potassium channels. It closes the potassium ATP channel, leads to depolarization of the cell, opening of voltage gated calcium channels, increases intracellular calcium, leads to insulin secretion. Insulin dependent action requires functional beta cells for efficacy, not effective in type 1 diabetes. Now, see the cell. This is sulfonylurea 1 receptor. This is the potassium channel. Sulfonylurea act on this receptor and blocks the channel, which blocks the potassium conductance, and also opens the calcium channels, leads to more influx of calcium. Cell become more positive inside. Normally, when there is less calcium level inside the cell, the insulin is resistant. By making the cell more positive inside, it decreases the insulin resistance, leads to secretion of the insulin. It opens the voltage gated calcium channels, calcium moves in, which leads to the insulin secretion. Pharmacokinetics, well absorbed orally with rapid onset of action. Metabolism, it is metabolized by liver, cytochrome P450 enzymes. Cytochrome P450 is a system of enzymes that can be induced or inhibited. So the drugs which inhibit the enzyme, it cause more the drug remains longer in the body and cause more side effects. When the enzyme system is induced, the metabolism is rapid. It is metabolized by the cytochrome P450 system. If the P450 enzymes is induced is faster metabolizing, the drug eliminates faster and the effect will be low. When the enzyme is inhibited, cytochrome P450 system enzyme is inhibited, it metabolizes slowly. Metabolize slowly means the drug excretes from the body slowly, and the duration of staying in the body is more and causes more therapeutic effects and also causes more side effects and drug interaction. Excretion, metabolites excreted via urine, renal impairment consideration. When the patient has renal failure, we need to adjust the dose according to the failure, percentage of failure. Like we consider the creatinine clearance and calculate the dose according to the creatinine clearance value. Half life, first generation, long half life, risk of hypoglycemia. Second generation, shorter and half life. When the half life is long, it's empties slowly and cause hypoglycemia. May cause hypoglycemia because it is acting for a long time. The shorter duration of action acts for less time. When there is a food, it acts at that time and cause less hypoglycemia. Therapeutic uses, the primary indication for the management of type 2 diabetes mellitus when lifestyle modifications are insufficient, when there is lack of exercise or physical workout, The combination therapy, frequently combined with metformin, DPP4 inhibitor, or other oral agents. Now see why it is combined with metformin. Metformin acts on insulin receptors and increase the sensitivity of the receptor. Increasing sensitivity means it decreases the insulin resistance, and a more action is achieved with less dose. By using metformin, we can use less dose of sulfonylurea to achieve the same effect. It synergizes the effect of the sulfonylurea. Also, the DPP4 inhibitors, normally there is a glucagon like peptide in the intestine that stimulate glucagon, and glucagon increases the glucose level. DPP4 inhibitors inhibit the glucagon like peptide, preventing the increase in insulin. Adverse effects most common because it causes hypoglycemia, because it decreases the insulin, decreases the glucose level. It causes hypoglycemia in elderly or those with renal hepatic failure impairment. When there is a renal failure, the excretion of drug from the body is less. The drug remains for the longer time in the body, and the therapeutic effect becomes more, because more time is given to the drug for the therapeutic effect. Weight gain due to increased insulin level, promoting the fat storage. Insulin increases the fat in the body and causes weight gain. Gastrointestinal gastrointestinal symptoms: nausea, vomiting, abdominal discomfort. Also, it delays the gastric emptying. Dermatologic reactions like rash, pruritus, these are the skin reactions. And rare side effects, hematologic effects like leukopenia, decrease in WBC, thrombocytopenia, decrease in platelets count. Drug interactions, enhanced hypoglycemic effect with NSAIDs, sulfonylurea, warfarin, and alcohol. As sulfonylurea is metabolized by the P450 cytochrome P450 enzyme system, and when another drug used in combination, it inhibit the P450 system. The metabolism will be slow and the drug excretion becomes slow. When the drug is excreted slowly, it stays in the body for a longer time and cause enhanced therapeutic action and enhanced hypoglycemic effects. Reduced effect, corticosteroids, thiazides, and beta blockers blunt the hypoglycemic response. Thiazides, beta blockers, these increases the glucose levels and reduce the action of sulfonylureas. Contraindications: type 1 diabetes mellitus. Why? Because it requires beta cells, and in type 1 there is a complete uh, lack of these beta cells. That lack of these functional beta cells, it cannot act on that receptors and cannot be used for type 1 diabetes mellitus. It is used for type 2, because in type 2 there is insulin resistance. Insulin present in the body, but it is resisted. Pregnancy and breastfeeding, because the drug may excrete in the milk and crosses the placenta, uh, uh, crosses the placenta and may cause fetal hypoglycemia. Also excrete in the breastfeeding. and may cause a child's hypoglycemia, severe liver and kidney disease, risk of accumulation and prolonged hypoglycemia. When there is a kidney failure, a liver failure, the drug cannot be eliminated from the body and stays for the longer time. So the duration of actions becomes more and cause accumulation of the drug. Self-allergy, rare, cross-sensitivity, and sulfur-containing drugs. Now come to the case study related to the topic. A 65-year-old man with non-insulin dependent diabetes mellitus present to his primary care physician for follow-up. He is currently managed with glyburide, sulfonylurea. His weight has increased from baseline of 195 to 230 during the past year. He walks approximately 30 minutes every other day throughout the year and eats 3 balanced meals per day. What is the most likely explanation of these findings? Lack of physical exercise, lack of proper diet, medication side effect, underlying hyperthyroidism, underlying malignancy. Now, see the first option, lack of physical exercise. Now, see the question. His weight has increased from baseline of 190 to 230 pounds during the past year. He walks approximately 30 minutes every other day. The option A, lack of physical exercise, is contrary to the question, which states he walks 30 minutes every other day, which is sufficient exercise uh, for diabetic patient. The second option, lack of proper diet. Now see the question. He throughout the year and eats 3 balanced meals. He's already eating the balanced meals, which is contrary to the option B, that is the lack of proper diet. Now think of the medication side effect. He is currently managed by the glyburide. We can think of the glyburide side effects that may be causing the weight gain. Now option D, underlying hyperthyroidism. Hyperthyroidism decreases the weight, not increases. So it is contrary to the question that is states the weight is increased. Underlying malignancy. Underlying malignancy is also not the cause. It doesn't cause a weight gain. It becomes contrary. So considering the option, can think of the medication side effect. Glyburide is sulfonylurea. As it increases the insulin secretion, the insulin causes the enhance the fat in the body and cause weight gain. So we can consider medication side effect option C to be correct. Uh, can we have questions? Metformin considered. Metformin increases the sensitivity of the insulin receptors. Yes. You may ask any questions, please.
Assalamu alaikum, sir.
Walaikum salam.
Sir, I am audible.
Yes.
Sir, I just forget this point. You just quote the first generation, the difference between first generation and second generation of sulfonylurea. I mean, first generation is less potent and more dose is required. And in second generation, you just said about more potent and less dose is required. सो सर आपसे क्वेश्चन बेसिकली ये था कि जैसे सल्फोनाइल में फर्स्ट जनरेशन और सेकंड जनरेशन में ये डिफरेंस है, तो बाकी लाइक एंटीबायोटिक्स और डिफरेंट क्लासिफिकेशन में भी यही जनरेशन में फर्क होता है, फर्स्ट जनरेशन और सेकंड जनरेशन या बाकी डिफरेंट ड्रग्स में.
There difference between mechanism action, side effects, potency. The difference may be different for those classification. In this specific case, the less potent means more drug is greater amount of drug is used to achieve the same effect as comparison to the second generation in which less dose is required. In antibiotic, we may consider for their activity or other things. We will discuss about that.
ओके सर, थैंक यू.
Like there are some dose dependent killing, or there are other types.
सर हिंदी में बताइए सर, इंग्लिश में नहीं समझ में आ रहा मुझे.
um, I'm sorry, because we have to use the language English. Um, Today's session was in English, so I cannot repeat the whole session in Hindi.
जैसे इंग्लिश भी बोलना है, बीच बीच में हिंदी भी बता, दोनों दोनों लैंग्वेज मिक्स करके बताइए ना सर, समझ में आ जाएगा. उससे नहीं हो सकता है सर?
देखिए, हमारे मोस्ट ऑफ द स्टूडेंट पाकिस्तान से हैं, तो हम उर्दू इंग्लिश का कॉम्बिनेशन कर सकते हैं. अगर फॉरेन कोई आएगा तो हम इंग्लिश सेशन के लेंगे. We will use English session if any non-English candidate in the session. Otherwise, we may use English and Urdu.
सर बेसिकली जो उर्दू और हिंदी है ये बोलने में सेम एक्सटेंट है, बट आपको पता है कि लिखने में सिर्फ डिफरेंस है. तो
जी
मे
जी
भी अगर आप उर्दू में भी बताएंगे ना तो ये भाई अंडरस्टैंड कर लेंगे इजीली.
जी जी, उर्दू में बताएंगे. उर्दू इंग्लिश हम ये कंसीडर करेंगे.
तो ये जैसे बाहर जाने की तैयारी कराते हैं सर, जैसे जैसे सऊदी अरब और फिर ऑस्ट्रेलिया, ये सब की कंपटीशन की तैयारी कराते हैं
जी
आप?
जी, कंपटीशन की तैयारी.
जी. जैसे आज पढ़ाई गया उसी उसी में पढ़ाया जाएगा सर, अगले अगले दिन भी जैसे स्टार्ट होगा तब?
जी बिल्कुल ऐसे ही होगा.
तो कैसे ले सर, कैसे आपको कैसे ये क्या बोलते हैं, ये ले ले हम सब्सक्रिप्शन ले ले, कैसे लिए जाए?
We will guide you personally for this. If you have specific question about this topic, you may ask. If you have any specific question about this topic, you can ask. Mechanism of action. Sure. See this diagram. This is the beta cell in which the insulin is already present, but it is resistant something hinders the release of insulin. Now, when the drug is given, it acts on the sulfonylurea receptor 1. It blocks, it plays two major roles. It blocks the potassium channel and blocks the potassium conductance, like potassium remains inside the cell. Also, it opens the calcium channels. The calcium moves in. The cell becomes more positive inside. Normally, when the insulin is resistance due to less calcium concentration, when the calcium moves in, the cell becomes more positive inside. It decreases the insulin resistance. It secretes the insulin, enhances the secretion of insulin. Okay, thank you for joining. Have a good day.